Hello and welcome to Journal Club today. So today we've got Alex and he's going to be presenting about ACTS. So I'm going to hand you over to Alex now for that reason. Okay.
Thank you, Seham. Okay. So ACTS was a study which concluded this year, and it was on the effects of ascorbic acid, corticosteroids, and thiamine on organ injury in septic shock. So just from the description of the title, I think I could ask most doctors, medical students even, what they predicted the main outcome would be of this trial. And given that the trial concluded earlier this year, and we are still not prescribing the so-called metabolic cocktail, which is the thiamine, the steroids, and the vitamin C, that would probably make it even easier. So I probably don't need to reveal the result yet, but you can probably guess it by the fact that we are not routinely prescribing these drugs for sepsis. A little bit of background. So this is from the actual paper itself, and it is their rationale, or part of their rationale, for the study. And I've highlighted probably the most important bits. So we have ascorbic acid and thiamine deficiencies have been described in people with sepsis. Interest in these therapies has increased recently. Basic laboratory and uncontrolled clinical studies suggest that these drugs may have a synergistic effect. And we've got several trials over the last couple of years with varied design and inconsistent results. And they say that on this basis, additional investigation is needed. And they also point out that ascorbic acid has been proposed as an adjunctive therapy for respiratory failure related to COVID-19. So as for the relevance of that, I can leave that up to you, and maybe we can talk about it later in the discussion. But as I say, this is from the paper itself. So context for this trial is very important. So probably the first thing we're looking at is a trial by Marek in 2017, which was a retrospective before-after study, and it was single center, and it showed that there was significant improvement in mortality for this set of drugs. And it was quite a marked improvement in mortality. So in the intervention arm, there was an overall hospital mortality of 8.5% versus 40.4% in the control group. So obviously that's extremely high. And it's so high, in fact, that probably, well, a lot of commenters have mentioned that because it's such a big difference in mortality, that immediately raises questions. And lots of issues were taken up with the method. So the fact that it was retrospective, it was a before-after study. The authors themselves were the ones who were involved in collecting the data, and several other reasons. Nonetheless, on the back of this trial, it was deemed to be hypothesis generating, and clearly people are so keen to find a so-called cure for sepsis that it warranted more investigation. And it did get more investigation. So there was also the vitamins trial in 2020, which was a better designed trial. It was still unblinded, it was multi-center, and it was randomized. And it also prescribed the metabolic cocktail, and it showed no improvement in 7-day mortality or vasopressor 3 days. So results weren't significant, but there was actually higher mortality in the intervention arm. And finally, some studies which we've already discussed. So approaches and adrenal, 2 studies looking at steroids in ventilator, in patients who are septic and mechanically ventilated. And they did show, or approaches did show, a mortality benefit for steroids in sepsis. So that's another important thing to think about in the background of this trial, is that giving steroids in certain septic patients has been proven to have a mortality benefit in approaches, and certainly to have ventilator and vasopressor free days, ventilator and vasopressor sparing effect. Another important part of the justification for the ACT trial was biological plausibility, and the authors actually go into quite a lot of depth in a separate paper, explaining why thiamine and vitamin C can be useful, and there's a link to that at the end if required. So on to the trial itself. The stated aim is to determine, I'm just trying to go to the next slide. Okay, the stated aim is to determine whether the combination of ascorbic acid, corticosteroids, and thiamine attenuates organ injury in patients with septic shock. And here's the method. So this is just a cut out from one of the graphics which they made for the study. So total of 205 patients randomized, and they analyzed 200 of those patients, roughly evenly, to intervention and placebo. The intervention group received vitamin C, hydrocortisone, and thiamine every 6 hours for 4 days. And it was done in 14 hospitals across the US. And the primary outcome was the change in SOFA score, which we're probably all familiar with. So SOFA is scored from 0 to 24, 0 being the best outcome, 24 being the worst. And it looks at sequential organ failure. And we've got the chart here. So this is what they were looking at.
I'm just going to mute you all. Sorry.
That's all right.
Okay, and then now just continue. Sorry, Alex.
That's all right.
To disturb.
So in terms of the sepsis, the other treatment guidelines were followed. So early antibiotics, aiming for a MAP over 65 with vasopressors and fluids, and early source control, as you'd expect. The study looks at change in SOFA score between enrollment and 72-hour follow-up. We'll just go back to that. Okay. Yeah, so at 72 hours. It's worth noting that patients were enrolled within 24 hours once they were identified as meeting inclusion criteria. So not immediately, and that again is something for discussion. And the reason for using SOFA was the hypothesized organ protective nature of the intervention. Again, we may question why they didn't look at mortality, why they looked at the SOFA score. So inclusion criteria, greater than 80 years of age, suspected or confirmed infection, and receiving vasopressors. And once again, we see enrolled within 24 hours once they were identified as meeting inclusion criteria. Exclusion criteria, again, is quite important for discussion later. So if they were allergic to any of the drugs, if they had a clinical indication for any of the drugs, so if there was a clinical indication for thiamine or steroids, then they were automatically excluded. And the others, I think, are less less important to look at. The main one, I think, is that they were excluded on the basis of having a clinical indication for the drugs. The protocol was written, I've just noted here, before approaches or adrenal were published. So although they may have assumed or suspected that steroids would be of use in vasopressor dependent sepsis, those results hadn't actually been published yet. If we go to the result, looking at the secondary outcomes, sorry. So there are two key secondary outcomes that they identified were kidney failure and 30-day mortality, and then several others as well, including shock-free days, which is significant actually in the results. So the primary outcome was the mean change in SOFA score, and it was non-significant. So in the intervention arm, there was a greater change in SOFA score, so it was more effective, but it was not statistically significant. In terms of secondary outcomes, there was no statistical significant difference in the incidence of kidney failure and no difference in 30-day mortality, although it should be noticed that in both cases, the intervention arm was slightly worse than the placebo, as I say, not statistically significant. Again, in terms of shock-free days, the intervention arm was higher, so there were more shock-free days in the intervention group than the placebo. And the authors of the papers said that this could be hypothesis generating. Obviously, as we know, the fact that they were giving steroids, it probably explains that result. Adverse events were similar between the two groups, so hypoglycemia, hyponatremia, and a new infection. Okay, so the strengths of the study were that it was blinded. So unlike Marek or vitamins, the study was well blinded at many levels. It was only the research pharmacists at each site who were aware of which way the patients were being randomized. The study drugs and placebo were delivered in light protected bags because vitamin C has a yellow tinge, and in every way it seems to be a better designed study than Marek's in 2017, which generated the hypothesis essentially for this study, and it seems that we can reject the hypothesis that was generated by that study. Similarly, the baseline characteristics were well matched between the two groups. So we've just got a list, or quite a long list, but generally speaking, the baseline characteristics were well matched. In terms of the study's weaknesses, so there were quite a few. So first of all, patients were not selected for the study on the basis of vitamin deficiency, and some other studies in the past, so not specifically looking at this combination of drugs, but other studies which looked at, for example, thiamine at reducing lactate in renal failure, I think, they based that upon, or they gave thiamine in response to a deficiency that was measured on blood results, as not what they did in this test. And if their hypothesis was that low thiamine could exacerbate sepsis, then we may well ask the question why they didn't test thiamine levels. Another problem is that patients were excluded, as I mentioned, because they were already receiving steroids or thiamine. So, for example, alcoholics. Now, arguably, these are the patients who would be most likely to benefit from the cocktail. So the fact that they were excluded suggests that maybe people who would have responded better were missed out. Time from vasopressor initiation to study drug administration was 13.5 hours. So again, we can ask the question, would earlier initiation of the cocktail have improved outcomes? We can also say that a large number of patients were screened but not randomized, which makes it more difficult, or we are less able to generalize from the data, and the authors acknowledge this. So if we go to the next slide, you can see actually of the 4,500 assessed, only 205 ended up being randomized, and there were actually 831 patients who were eligible but not randomized, and you can see the reasons for that on that table. Again, acknowledged by the authors, the study didn't have statistical power for subgroup analyses, and it did not have the power to detect small differences in mortality. So again, essentially not enough numbers there. And finally, as I touched on earlier, the SOFA score isn't a patient-centered outcome, i.e. it's not looking at mortality. So it's basically just looking at numbers. And again, we'd have to ask how the SOFA score translates to actual patient outcomes, and why they looked at the SOFA score instead of, for example, mortality as a primary outcome. So discussion. This is a quotation that I stole off Robert Dixon, and I'll just read it out. I thought it was quite accurate. So he says, there's been a tremendous amount of interest in vitamin C as a treatment for sepsis, and it's based largely on one small single center observational study. So that's Marek. We've now got 3 decently sized randomized controlled trials, all in agreement. Vitamin C does not reverse organ failure in sepsis. So those are vitamins, which I've already mentioned. There was a study called Citrus Ali, that's ALI, which was looking at sepsis and ARDS, and they gave vitamin C for that, and it didn't show a significant change. And there've actually been a couple more studies as well, which again were non-significant. And he says, if the signal of benefit for vitamin C was anywhere near as strong as was initially suggested, it shouldn't be this hard to detect it in clinical trials. So the study has clearly not changed practice, but it does raise questions. I found it interesting because it raises questions about which studies get done and what they look for. So clearly, people are keen to find a so-called cure for sepsis. If we could find that, then that would be amazing. It would be incredibly valuable in terms of patient life and in terms of just spending. However, does that mean that money should continue to be ploughed into something which has actually been fairly well exhausted and shown, and as Dr. Dixon said, in 3 large randomized controlled trials to have no effect? On the other hand, some centers, I think particularly in the US, were giving the vitamin C and thiamine and steroids on the basis of the 2017 trial. And the very fact that they were giving this perhaps warrants an investigation or a study to see whether it's justified. So I suppose there are 2 sides to that story. Again, we could question why they were giving something based upon such poor evidence, and I think maybe they can argue that well, it doesn't do much harm, but still that isn't evidence-based medicine. And again, we can have a discussion about giving treatment even when it doesn't do much harm, and why that's not necessarily a good idea. There is also a meta-analysis with ACTS and a study called VICTAS, which is yet another similar trial, and VICTAS is across 43 sites, so it should have a much higher number and proportion of patients enrolled in it, and perhaps that will put the topic to bed for a little while. That is all. Are there any questions?
Thank you, Alex, for your talk. Very interesting topic. Lots of very good trials that you've discussed. So I'll open it to the floor if there's any questions. Just please unmute yourself.
Alex?
Yeah.
I might have missed this at the beginning, sorry if I did, but is there any, what's the actual underlying thinking behind vitamin C being beneficial in sepsis? I mean, is it just based on sort of observational, anecdotal observational evidence, or is there sort of...
No, so there is a biological basis for it, and the authors of this trial justified the trial in a separate kind of mini paper, where they gave a rationale for it, so not just on the basis of the previous trial. And they said that ascorbic acid, so vitamin C, is an antioxidant. It's an electron donor that directly scavenges free radicals and prevents the generation of new free radicals by suppressing NADPH oxidase, and it assists in the recycling of other antioxidants. And I think for sepsis, crucially, they say that the antioxidant effect of ascorbic acid results in reduced endothelial permeability, improved microvascular and macrovascular function, and attenuated cellular apoptosis in pathological states. And then they go on and describe other effects it has on the immune system. So in theory, perhaps you can see why they wanted to look into it.
Okay. Yeah, brilliant, thank you. Cheers.
Any other questions from anyone else in the room that wants to ask in the chat or anything?
I know you talked about these patients being on vasopressors already, but did they look into using these drugs to prevent people getting onto vasopressors?
That's a good question, and as far as I understand it, so looking at
quite a sick collection of septic patients, if they're already on vasopressors, just wondering if it had any role in preventing them from getting to that stage.
That's a good question, and I don't know.
Yeah, okay.
Alex?
Yes.
So do you think, so Marek is a very big name in the world of critical care. He's produced a textbook, he's quoted by lots of different people. In a study that, to me, there was a massive, huge problem with it. It got published. I suppose to be a lot of things sometimes that goes back to with that consultant I published to do with the vaccination and autism. What are your views on that with the original paper, other than...
So the original paper, I wasn't around, I wasn't really following it when it was published. It was published in 2017, and it seemed to cause quite a lot of controversy then, just from looking at journal clubs online and kind of Twitter reaction to it. And quite a lot of critical care practitioners seemed upset or frustrated by the fact that it had been published. And I think there is an argument to be made that it's done, maybe not damage, but at least set back kind of the progress of clinical critical care trials, simply by the fact that it's so-called hypothesis generation of studies like these. It's difficult, obviously, you know, as a junior doctor with a couple of years' experience, to call out someone who's a well-respected critical care physician, but it makes you wonder what his motivation was for publishing the paper, and you know, whether it was actually quite disingenuous.
Okay. Anyone else? So what's the summary then, Alex, to wrap it up?
The summary is that there have been lots of studies into a combination of vitamin C, thiamine, and steroids as a treatment for severe sepsis, based upon one single not very well designed paper in 2017. There has been no evidence that such a combination of drugs improves mortality. Nonetheless, it's probably a question that's not going to go away immediately, and we may await a meta-analysis of this trial and a study called VICTAS, which should include many more patients, and hopefully may put it to bed.
Okay, thank you, Alex. Great talk today, and we'll see you all for next week's Journal Club.
Well done, Alex.